Usually, lifestyle,
Right.
how they're living, what they're eating, how much they're eating, their education into nutrition, and lifestyle and exercise and all of those things. Not having structure, not having routine, maybe how they were brought up, they don't see anything different, and then it just carries on into their lives. And then, you also see many obese parents. If you look at their children, there's often a strong correlation with obese children and obese parents.
Yeah.
Right?
You can get as strong as possible as long as you're not doing steroids. You're never going to look like a man. Like, please get that out of your head, because that's what's going to help your metabolism. Like, and I was thinking about this because Tom brought up, is it better to have the muscle and be a little fluffier? I would go that route. I'd rather have more muscle and be fluffier, because then if I made a decision I needed to lose weight, I would lose it faster because I have more muscle.
Champion bodybuilders, Jay Cutler, C-Bomb, right? They, in general, in health and wellness and fitness, what burns fat is muscle, right? So to keep your metabolic system going is your muscle.
Anybody can go on semaglutide and lose weight, but what a lot of people are finding is, one, you're not prioritizing protein and you're not prioritizing strength training, so you're losing weight, and you're losing weight rapidly, but you're losing more muscle than you are actual body fat. Here we are, Real Recovery Talk. I am your host, Tom Conrad. In today's episode, we've got Benjamin B.
What's happening, everyone?
And we got Dr. T.
Hello, hello.
First things first, thank you for tuning in on the podcast app, whichever one that you choose to use. And thank you for watching on YouTube. In the end, if you have any comments, questions, or concerns, you could always reach us, info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message, right, Ben?
Yes, that is what we're doing here.
Right, T?
That's right.
How's it going?
Good.
It's good.
You had a yawn there, Ben. You getting a little sleepy.
I am. I'm a little tired.
Would you like some Celsius?
I already had a half a scoop of pre-workout this morning, an Americano from Pump House Coffee, and 1.5 Celsius already.
Wow.
I know I need to. Usually I don't do that much. Today's a little much.
Okay. Well, this episode is brought to you by, nobody. But if it were to be brought to you by somebody, it should be brought to you by Celsius. Celsius is my go-to energy drink.
Since when?
Since today.
I've literally never seen you drink one.
No, I've actually had a few. They're really good. But you know what got me? It says burns body fat on it.
How many milligrams of caffeine is in 1 Celsius?
200.
200.
What is the recommended daily dose of caffeine in the adult male?
I have no idea.
What?
I'd ask you that.
I think I know the max.
It's pretty high. What?
Is the max 600?
400.
400.
Oh, so even with this, I'm below, because I only had 1 cup of coffee this morning.
Yep.
Yeah. But I'm going to shotgun this, and then maybe... No, I'm just kidding.
Alcoholic.
I've only had half of this, but it's pretty good. It's pretty tasty. Arctic Vibes Sparkling Frozen Berry Edition.
I still chug everything.
Me too.
I can't help it.
Yeah. On this, I didn't, but normally, see how I dent my can? Right? I didn't.
Yeah.
I just did that now. But that's how I would differentiate. That's how I would know what beer was mine. I would dent the can.
See, I'm too OCD to have a dent in my can.
Yeah?
Whitney gets real upset with me because, if she leaves her energy drink in the morning, she starts every day out with the Celsius. And if she leaves it...
You'll drink it?
Yeah, I take my sip, and she's like, it's half gone.
Which is a typical male sip.
Yeah, okay.
Yeah.
Like Pierre's like, can I have some of your whatever? No, you cannot, sir. You can get your own drink.
Yeah. The only thing I would wish, because this is rather tasty, why can't you make this twice as much volume, keep the same amount of caffeine? You know what I mean? This is, what is this, 12 ounces?
They just came out with the bigger can, but that might be the case. They might have that. New.
I have seen, actually, bigger
Like a
cans of
Monster
this.
size?
Yeah.
How much? I don't know. A Monster.
A
16
Monster was
ounce.
only 160 milligrams per can. I looked the other day.
Right. So
I
now
was
you're
surprised.
cramming 200 into this little thing.
So you get a big can, but Monsters,
How
No,
much?
I just
syrupy.
meant volume wise. That's
Yeah.
all. I don't know what the volume is on a Monster.
16 ounces.
Oh, okay.
Yeah. How much is a 5-hour energy, caffeine wise?
Ooh, I don't know.
I don't know.
It's a lot. But anyways, it burns fat. That's what prompted me to buy it.
See, but that's the thing. 5-hour energy. That's like it's a shot. I don't like that.
Yeah, I transitioned
I
away
need
from
more
that.
volume. Yeah.
I transitioned away from that and you went right back to it.
You're
I
marketing
know.
bait, and I think that's good for today's discussion.
Well, and that's what I was going to do. That's what I was transitioning. If you would like to burn fat, maybe have some Celsius, or you can get gastric sleeve surgery.
or yeah.
Or you could just eat in a calorie deficit. You could work out, you could strength train, and you could watch what you're putting into your mouth on a daily basis.
Right.
No offense to people that have gastric sleeve surgery. I obviously know people need it, and it's a medically sound treatment, I think. But I don't know. I'd be curious to know the doctor's opinion on it. See
And
what I
as
did
it
there?
relates to alcoholism.
Yeah, that's primarily what we're doing. We're going to discuss what's the proper terminology for it.
Bariatric surgery.
Bariatric surgery and its effects on people and the risks that they run to develop alcoholism. Is that a fair statement?
Yep.
So
You started off earlier when we were talking before we hit record that you've been seeing more of this, or just consistently cases lately.
Yeah, it comes in waves,
Yeah.
but a lot of times there's, I say, what's your surgical history? And they'll say, I had gastric sleeve or I had Roux-en-Y, which are two separate procedures.
Roux-en-Y.
Roux-en-Y. Yeah, it's just the name of the procedure.
Okay.
And that's the same. Gastric sleeve is the same as gastric bypass surgery.
So it's a type,
Okay.
right? Like if you had gastric bypass surgery as a heading, there's two types that we're talking about here. Gastric sleeve, that's where they take, basically they snip 80% of your stomach out and they put it back together so it looks like a little banana. That's gastric sleeve. And then the Roux-en-Y, it's a bigger procedure, and it's where they take the top portion of your stomach and leave like an egg size pouch there of your stomach, and then they bypass the rest of your stomach and connect it to the small intestine. So it is getting rid of a large part of the stomach as well. It's not taking it out, it's just pouching everything off, rerouting it. So in essence, the outcome on each side is they've significantly decreased the size of the stomach.
Can you undo the second one since it's like it sounded like an add-on?
It's not an add-on, they just reroute.
They like
basically.
stitch it or something?
Yeah, they
Or-
suture it. I mean, I'm not a bariatric surgeon. I didn't do any of my clinicals in bariatric surgery, so I probably couldn't answer some of the specifics about it. But in general, that's the gist of it.
It blows my mind that it's 80. They take 80% of the stomach out.
So what prompted, and this was both of your idea on, I think it's a great idea, first off. But what prompted this, wanting to talk about this?
I think it was me.
Yeah, it was.
Because we've been talking a lot about like wellness, exercise, alternative, holistic therapies. That was one aspect. The other aspect is just in the last like 2 weeks, I've seen a lot of patients that have it in their history, and it's always alcohol is their substance of choice.
Yeah, like I said, I think it's a great idea. I would have never thought to, but that's why we have you.
I was trying to think back at past cases, and I guess I had heard this, but I don't think I put two and two together so significantly that like they are directly correlated to increased risk of alcoholism, if you will. That's correct, right? Mm-hmm. And the one thing that I was thinking back to past cases, though, I have seen a couple cases too where they get gastric bypass surgery and then get addicted to the opiates for post surgery too.
That's
But the alcoholism was what really that can happen with any surgery. I think as it relates to alcoholism is kind of interesting for this topic.
Yeah, I would like to definitely talk about the alcoholism aspect of it, but I also think that this is a good way to discuss just addiction in general. You know, a lot of times we focus on drugs and alcohol, but oftentimes when people are getting some sort of gastric bypass surgery, it is because they are addicted to food, most generally speaking. You don't have, at least that I know of, there's no medical conditions that can cause you to gain this amount of weight. I mean, you know, you hear about, what is it, Hashimoto's or like different sorts of like hormonal thyroid diseases and stuff like that that's going to cause you to gain weight, but nothing, at least from my perspective, and T, you correct me if I'm wrong, is there any sort of medical things that your body can do to cause you to gain that amount of weight? Because
it's usually, you know, lifestyle,
right?
How they're living, what they're eating, how much they're eating, their education into nutrition, you know, and lifestyle and exercise and all of those things. Not having structure, not having routine, maybe how they were brought up. You know, they don't see anything different, and then it just carries on into their lives. And then, I mean, you also see many obese parents. If you look at their children, there's often a strong correlation with obese children and obese parents.
Yeah. Right?
Because they're passing on what they've learned from the generation above, etc.
What's the medical side, the biology side, if you will, physiological side of the like increased risk of alcoholism after having gastric bypass surgery?
So yeah, alcohol is metabolized in your stomach, right? So one of the enzymes, alcohol dehydrogenase, breaks down alcohol in your stomach before it goes to your small intestine. So your body has time to kind of break down the active straight alcohol. But what happens is when your stomach size is decreased, you're decreasing the amount of enzyme that is there and available to break down the alcohol. But also the alcohol now is going basically straight to the small intestine as well. So it's twofold. So they just get instantaneously drunk. It's like equivalent to doing IV heroin. You know, it's like if you take an oral opiate, it takes time. You have to break it down. It has to get in your system. The time to ingesting it to that feeling, you know, it takes time. Well, if you remove that in an alcoholic, that's an instant, it goes straight through their body, straight instant drunk.
It's like removing the filter in a way.
Essentially.
I study a lot of history. The ancient Mayans, they did a lot of alcohol rectally.
Yeah.
I was just going to bring that up. Steve-O did that. Remember? Jackass? I don't know if it was Steve-O, but it was one of them. Mm-hmm. They called it boofing.
Boofing, yeah.
I had a patient not that long ago in one of my detoxes when we asked him, you know, how much you were drinking or taking in a day, and he was like 3 bottles of wine. We were like, okay. But he was like, I did enemas, wine enemas. That's how I ingest it. He's like, I didn't like drink it. I just did it via enema. Up to 3 bottles a day.
Oh my God. How do you even, I'm an alcoholic. What? I'm just trying to picture myself at home.
Trying to figure it out.
Doing.
Stop talking, because I don't want to picture you at home doing this, Tom.
Beer booty bongs, you know? Got my butt in the air and
I mean,
just bonging beer through my butt.
Yeah. It's the
That's
absorption.
Crazy.
Mm-hmm.
But again, it goes to the insanity of it, because if you think about it, ingesting 3 bottles of wine, the havoc that would wreak kind of on your stomach, you know, and the way that it makes you feel. I mean, not that it would make you feel any better putting it in your butt. I don't know. It doesn't make any sense to me, but
they do it with other drugs too, though.
Yeah.
But here's the thing,
because it's more potent.
Mm-hmm.
Here's what's interesting. You see people that we laugh at that, but like when somebody says, "Oh, I drank hand sanitizer," we're like, "Oh, that's kind of normal." Like, you know what I mean? It's viewed differently because you're putting it in your mouth, but the insanity is still the same.
Yeah.
You know,
no, it definitely is.
It's not like Steve-O just doing it for, you know, to put it on a TV show, and that's part of his character. But
That's why I say addicts are smart, and without knowing it, like without knowing human physiology, they figured out that if you put substances rectally and how it's absorbed and how much faster it's absorbed, that you get higher faster. They are always finding ways to.
Yeah.
But I mean, it's smart.
Drug addicts are smart.
Definitely.
They figure out everything. Like when they put the gel, when they made the jelly Oxycontins, like people figured out how to put them in the microwave, do cold water extraction, all this crazy stuff. And I'm like, dude.
So if you're an alcoholic and you've had bariatric surgery in some capacity, can you build your tolerance up the same way as you would if you didn't have the surgery? I imagine so, right?
What do you mean?
Like when I first started drinking, I would be drunk off of 2 beers. But fast forward 10 years later, I'd be drunk off of 22 beers.
Oh, yeah. Tolerance is still, that theme or mechanism is still there.
Because you build your tolerance by way of really...
It'll be a new tolerance, once they have surgery. They tell most people preoperatively, like you should abstain from alcohol, cigarettes, smoking, certain medications, everything like that, a year in advance or try to 9 months to a year in advance. So if they really do that and then they have surgery and then they actually drink, one drink's probably going to be enough.
Well,
to get
that
them
was going to
drunk.
be my question. Do they, like you said, in advance, but do they let them know the risk of increased alcoholism?
Well, that's what I asked. That was what I started getting inquisitive about with patients. Like, what was before you had surgery, what was it like? What did they say to you? What type of testing? What kind of history did they take? What kind of education did they give you? Some people say that they were given the information, and some people said like maybe they did. I didn't pay attention because I never thought I would become an alcoholic. Maybe it was just something I glazed over. But yes, before you do bariatric surgery, you have to go through a nutritional assessment, a psychosocial assessment to assess for depression, anxiety, mental health, disease, a medical assessment, and an anesthesia assessment. But all that happens, 3 to 6 months prior to a surgery, where we all know that disordered eating in a patient like that, it has been their whole entire life. So yes, they're screening them, but what are they doing to help the patient other than just sending them to surgery? And once they get the surgery, what type of program are they giving them after? Yes, as a surgeon, you have to follow up your patients, 1 month, 3 months, 6 months, 9 months. But what type of program are they giving people like that? It's like addicts, you have to have something set and sound. You don't just say, okay, here's your surgery, good luck.
Just to kind of throw it out there, maybe some of our listeners aren't familiar, but there are programs such as Overeaters Anonymous. It's a 12-step program very much related to Alcoholics Anonymous, Narcotics Anonymous. But I'm almost thinking in my head, like correlating the two. It's like, it sounds to me if somebody's having a surgery of this type that they probably had food addiction first is what you've been getting at. And it's like almost like you're taking that away and then they replace it with alcohol. Like you're switching one addiction for the other, and I don't think people realize how addicting food can be. Like it can be like any other addiction.
Well, if you just look at the population as a whole, you walk down the street and 9 out of 10 people that you pass are going to be overweight or obese. And does it mean that every single one of them are addicted to food? No, but they definitely aren't addicted to healthy food. You know what I mean? Like, so I think the barrier of entry is so low when it comes to food. Like it's readily available anywhere you go. We were the three of us, we were just at Wawa, and I'm standing there and, they put the cookies and the candies and the cakes up on the register, very strategically put there. And I pick one of the brownies up to look at the nutrition facts because I'm always fascinated by that kind of stuff. And the brownie, I'm not kidding you, is probably maybe 3 inches by 3 inches. And you turn it over, it says 130 calories. I'm like, that's bullshit. I know that. It's three servings in the one brownie. right? So somebody picks this brownie up, and a lot of them uneducated, they turn it over, they look at 130 calories, they walk out, they scarf the whole thing down. You just ate 390 calories. Do that times, and I ain't eating one of those brownies. I'm probably eating 2 or 3 of them. I'm dipping them in whole milk. You know what I'm saying? Like now I just threw down 1,000 calories and don't even realize it. Am I addicted to food? No, I'm not addicted to it, but I'm not mindful about what I'm putting in my body. And then you look at the people that are addicted to food, they're using it in the same way I used alcohol and you used heroin. You know, it has developed into something that I'm using it now as a coping skill. You know, I use Oreos to cope sometimes, but it's not like it's not causing me to lose my job or suffer major health consequences and stuff like that. When people that are addicted to food, it's arguably probably next to alcohol. It's very horrific, you know, as far as how slow and how progressive it is.
Now that we're kind of on track with talking about this, I always have a tendency to think of certain cases, and I'm curious from your perspective, Dr. T, like how often do you come across people that come into treatment for whatever addiction? I mean, at this point, could be alcoholism, could be anything. And most of the time we'll see that they come in underweight. Like when somebody gains 30 pounds in detox, usually I'm like, good, you know, you needed that. But then we see it here sometimes even where people will eat, and they are putting on weight so quickly. Like when you're meeting with clients, how often does that come up, and what do you say? Do you
It comes up often. We do address it because we see them so frequently here, but they're aware of it. You know, a lot of times the patient, I'll notice it, but the patient's aware and says, you know, I'm really struggling right now. I've gained X amount of pounds since I came to detox. I've been now in treatment for 30 or 60 days, but my eating habits are like, when I go to the grocery store, I just want snacks and sugar, and that's the only thing that's comforting to me right now. Like you said, you know, so it's like, okay, well, we need to talk about really what's going on beneath that. You know, you're obviously struggling emotionally, whether it's anxiety, mood, lack of sleep, your sleep is disordered. You know, we really have to hone in on that and collaboratively with their therapist make a plan, because otherwise it does spiral out of control.
Or I'm trying to think of all aspects of this. Another thing that I've seen is they start putting on a ton of weight and then they do something really unhealthy to lose the weight, like start restricting themselves in a serious. Then you go the other direction with like anorexia or whatever. It's all over the place. And I think this comes back to the whole point in us talking about this, that addict mentality, that addict mindset, all these habits, and I don't know, that the underlying issues that aren't being addressed to begin with, I think is the whole point we brought this up. You know, it is.
Well, the alcoholism. Well, the bariatric surgery is addressing the physical aspect of it. It's addressing the extra 300 pounds that you have hanging off of you. That's what the surgery is doing. But it's not addressing anything else.
Right.
And I think that is where you're going to see the alcoholism, because, Ben, you're right. You don't address the underlying issues. Your body, at least, I don't know, a month post-op, you're not able to use food as a crutch, but you are able to sip on a bottle of vodka.
Yeah.
You know, and so that's, I think, one of the biggest issues with this whole thing is that we're a society of just wanting the quick thing, the quick fix. And we get that quick fix, but we don't address the core issues, the root of the problem. And then that quick fix no longer works anymore. And that's why I think we're seeing a lot of this whole freaking Ozempic coming to the surface.
Dr. T brought up semaglutide earlier.
Yeah.
Name brand's Ozempic, right?
Mm-hmm. Yeah. It's a semaglutide is what, a peptide or a
well,
Go ahead, Dr. T.
So
Let the doctor take it, Tom.
Not to get into too many specifics, but basically what it does is it slows your gastric emptying. So that means it slows the rate at which your stomach is processing food and pushing it down into your small intestine. So what happens is the stomach stays stretched longer, which means the stomach sends hormones to your brain that says I'm full. So it increases your satiety, right? Because if you have food sitting there, it's not in transit, your stomach stays stretched, you say I'm full. Alternatively, though, it does also help regulate your glucose levels. So those of us who are just normal in life, our glucose levels are constantly going up and down based on what we eat. If you're eating a lot of carbs and sugar, what happens? You're getting these massive glucose spikes, and then you get these drops. And that's when you feel tired, fatigue, and then you're really, really hungry and you want to binge eat on something. Most of the time when people binge eat, what do? They eat more carbs, and then they go through this cycle all day long.
Yeah, the two in the afternoon nap, is something that I personally go through, which is why I have my Celsius here. Do
they have any statistics on like how many people quote unquote relapse or gain their weight back or whatever? I
don't think there's any long-term data yet because it's so new, but they are seeing that people who abruptly come off, because you can dose-wise increase it, right? And you can dose-wise decrease it back down, kind of like a pyramid. So people come off of it slowly, but some people just abruptly stop it for whatever reason. Mm-hmm. And those people are most at risk for having rebound weight gain, because all of that's taken away. And if they didn't build a solid foundation with it, meaning, they didn't learn about nutrition and macronutrients, micronutrients, exercise, how does carbs versus proteins versus fats affect your blood glucose levels throughout the day and spikes? If they don't have any of that knowledge, then they're just going to fall right back into their disordered eating habits.
That's what the semaglutide. What about going back to the gastric bypass stuff? Because that's been around a long time. The semaglutide's a pretty new thing. Mm. Do they have any statistics on people gaining their weight back with that? They
said, the studies vary, but within 10 years, 20 to 25% of people end up gaining their weight back or more.
How's that possible if their stomach's small?
Because it'll stretch.
Yeah.
It grows back.
Mm-hmm.
It's like elastic. Yeah. Mm-hmm.
But that's for me, it's analogous gastric bypass, semaglutide, whatever you're doing. If you don't have a solid foundation with nutrition education, exercise, knowing how the body works with blood glucose levels, if you eat, they tell you, try to eat every meal with, some fiber, some protein, maybe a little bit of carbs, and a little bit of fats, because what's going to keep your blood glucose regulated is your fiber and your protein, right? But, just little things like that.
See our boys over at Mind Pump, that's day 3 in a row that I've
It's probably day 353 in a row.
They talk a lot about this, and the with the semaglutide in particular, you have a lot of camps of people that are supporters of it. And Mind Pump, even in their defense, they're somewhat supporters of it, but they're very open about the fact that, but you need to be addressing the root issue.
Correct.
Anybody can go on semaglutide and lose weight. But what a lot of people are finding is, one, you're not prioritizing protein and you're not prioritizing strength training. So you're losing weight, and you're losing weight rapidly, but you're losing more muscle than you are actual body fat. And muscle tissue takes up about 1/3 of the same amount of space as fat does. And so you're seeing a lot of people that are losing a ton of muscle tissue.
Right.
And it's so would you rather be maybe a little bit more? I'd be curious to know, in terms of health, are you healthier, a little bit heavier, maybe a little bit more fluff, but you have a lot more muscle tissue, than being thinner and having, maybe 1/3 less muscle tissue than you had before going on the semaglutide. I don't know I don't even know if they have the answers to those right now, but from my understanding, and like, Lane Norton and a lot of these guys, Dr. Mike Israetel, a lot of these people, they talk about the most of your health benefits are going to come from about 10% of body weight decrease. So the most, if I'm 220, if I lose 22 pounds, generally speaking, I'm going to get the most health benefits from those 22 pounds. Now, how much of that is fat? How much of that is muscle? I don't know, but it's pretty interesting. But the core stuff is what people don't address. And then, can you stay on that forever?
We don't know yet. We don't know the long term. We don't know that information's going to come out years from now.
It sounds really bad to me. Like if your stomach is digesting slower and food, it's like, would the proper word be septic or like
rot, gut rot?
Yeah,
No.
like if it's in there too long.
No, it'll eventually be digested, but you're not going to also keep eating food on top of that food because you feel full. So your body will eventually, but people with it, they'll get like acid reflux from it, like really bad because, food's just sitting there. So
Tom touched on strength training. I want to bring this up since you're sitting here because this drives me crazy, and maybe you can myth bust for everything because I want the doctor to back me up on this one. So hopefully I'm not wrong.
Am I in the same camp as you, or are you trying to?
You got to be in the same. Yes,
okay.
you're in the same camp
Yeah.
as me,
Good,
for
let's
sure.
go.
I just want her to back it up because she's got the credentials.
Yeah.
One thing that drives me crazy, and I was just talking to a good friend about this who's in recovery the other day, a female, wanted me to kind of guide her in the right direction with some nutrition stuff. And, I bring up strength training to her. She's getting on the stair mill, the step mill, the treadmill, and like that's the gym time. And I'm like, why not implement some strength training? And her response, and I get this all the time, especially with our female clients. Well, I don't want to look like a bodybuilder.
Oh, no.
And I'm just like, I literally have to tell every one of our female clients, you are never going to look like a female bodybuilder unless you take anabolic steroids. Like you can get as strong as possible as long as you're not doing steroids. You're never going to look like a man. Like, please get that out of your head because that's what's going to help your metabolism. Like, and I was thinking about this because Tom brought up, is it better to have the muscle and be a little fluffier? I would go that route. I'd rather have more muscle and be fluffier because then if I made a decision I needed to lose weight, I would lose it faster because I have more muscle. Versus if I'm just got extra fat on and no muscle, then I'm going to have to build muscle anyway to speed up my metabolism. But can you please tell the crowd?
You hit it on the dot, both of you. It's that, if you look at champion bodybuilders, Jay Cutler, C-Bomb, right? They, in general, in health and wellness and fitness, what burns fat is muscle, right? So to keep your metabolic system going is your muscle. So you won't turn into or look like a man. Strength training is very important for females and males because the more muscle mass you have, the easier it is to burn body fat. So like bodybuilders, they don't do any HIIT. They don't, you don't see them doing HIIT. You don't see them doing
What does HIIT
CrossFit,
stand for our listeners?
high intensity training.
Interval training.
Interval training.
Yeah.
Like Jay Cutler, he walks 30 minutes a day, like 3 days a week. That's his cardio. And he still looks like he does because obviously he's probably doing testosterone supplements, but he's focusing on feeding his muscles, the diet, which is like 90% of utmost importance. And he's doing strength training, which is the other 10% that's important to us.
Well, I do think, though, it's safe. As a disclaimer, we are not advocating to live the lifestyle of a bodybuilder. Ben, you can't even advocate, right? And you're going through a bodybuilding show right now.
No, we were just, Tom and I jumped on the Q&A for Mind Pump.
Yeah.
And they brought it up. They called bodybuilders selfish, which I don't disagree with.
Yeah.
But it's taking it to an extreme.
it's not healthy.
No, to do it long term for your whole life.
But in general, like how
The principles behind it.
exactly the principle. The more muscle mass you have, the more your body's going to be able to break down fat. Now, to answer your question, prior to that, what is unhealthy for adults in the medical world is visceral fat.
Right.
Fat that surrounds your organs. So if, like you said, if you have less muscle mass, but you're skinny fat, essentially, that is more unhealthy because you probably have more visceral fat. If you went and did a DEXA scan, or checked your body fat percentage, that's probably going to be more unhealthy than someone who has more muscle mass and is a little fluffier.
That's why all my fat's right in my belly. It's good. It ain't around my organs. It comes right out the front.
I want to tie this too, because
you didn't laugh at that, Ben. I thought that was funny.
I know. I was already like in thoughts ahead. Sorry, Tom.
That's okay.
We had a gentleman who has been with us recently, an older gentleman, severe alcoholic, shakes really bad from the alcoholism. Is there any science behind the fact maybe strength training reduces? Because in my head, I'm thinking it would kind of make sense, like that nerve connection,
like the nervous system.
The nervous system is getting better connected because you're getting the blood flow to the muscle, the arteries and the veins. Is that's your river. The nutrients are getting there. I would think that it could reduce long term, like shakes and stuff like that.
There's no evidence that I know of. Because sometimes there is something called familial essential tremor, where it's a genetic inherited trait where you have this fine tremor. Now, if you don't have that and people do have shakes, usually a lot of times it's anxiety driven in conjunction with post-acute withdrawal symptoms. So in that sense, I would say yes, exercise would help them and to blow off that extra energy, that anxiety, the steam. But I don't think there's any direct mechanism by strength training and improvement of a tremor.
I didn't know it was from anxiety.
Oh, yeah.
Like the shakes?
Mm-hmm.
Yeah.
I thought that was something else. Tom's the prime
example.
Yeah, dude, I shake like a leaf. No, I think, well, this is a good episode. I could talk about this stuff for hours.
I know, I'm having fun right now.
There was one thing that I was going to talk about with the muscle mass and the women.
I have one more.
Oh, go ahead.
Yeah. So I was also explaining to this lady that I was talking to, this friend of mine. She admitted, I'm not calling her old. She's like, I'm getting older. Mm-hmm. And she is. She's worried about her bone health,
mm-hmm. Bone
density and all that. And I was, she's like, oh, I'm worried about that, so I don't want to do too much strength training. And like it does, if I'm not incorrect, increases bone density. And the other way that I look at it as well is say, for instance, you got a bum knee. If you build up the muscle around the knee, that's even more structure holding it together, and you're not necessarily resting on your bones. And when I train our clients here, I pay attention to this too. We have one young lady that has been doing awesome with the workouts. I'll tell you who afterwards. Can't say her name on here. But I noticed every time she did a lift, she would rest on her bone structure versus holding herself with her muscle. Her knees would be locked straight, and she'd be bent over doing a row, which is supposed to be for your back, but she'd be dangling, using her bones rather than her muscle. And I was explaining to her, hey, if you bend your knees properly, engage your legs and everything, you're going to get your bone density. You're less prone to injury long term, all that stuff.
Well, I think it's just listening and being, having somebody like you being there, because she doesn't know. Yeah. So if you're there to kind of instruct her and to, give her the advice.
To answer that, I think too, women think when they think weightlifting, they think powerlifting, bodybuilding. It doesn't have to be heavy weight at all. It could be the lightest weights, multiple sets, multiple reps, depending on what you're aiming for. If you want a lean, nice looking body, you got to do more reps at lighter weights anyways. So we're not, the stimulus is always going to be different, but they don't. No one has to lift heavy or.
God.
There is a pro and a con to this. The con up front is convincing them that females that strength training is good and they won't look like a bodybuilder, etc. The pro is, at least my experience here at Rock, they are so much more teachable and open-minded, and they come in. The men, they just kind of come in, they want to bench press 300, and they just, doing stuff that they probably
want to
should.
look like they're on steroids without taking steroids.
But I got to hand it to the women, and actually just the thing about it is I want to give them props because I get more participation from the women here in the strength training. Once they buy in and I break past that nervousness and that barrier up front, I've had huge groups of women working out, and usually it's like 1 or 2 guys lately.
Well, here we have an environment that fosters kind of, more of a community style workout. Mm-hmm. So they're comfortable with all of our clients and stuff like that. I'd be curious to see kind of what they do when they do go back home, and if they're going to join a gym, and if so, like if it would be more of like a group fitness type setting, or if it would be like, your typical what like an LA Fitness, Globo gym, Planet Fitness, something like that, because the atmosphere here is, it's comfortable, and they obviously know you, they know the clients and stuff like that, but we are giving them a taste of what it's like. And Caitlin is a very good example, who she's coming on the podcast.
Oh my God. Yeah. What a great example.
She's coming on the podcast, which I can't remember when we did schedule it, but
Is she?
I don't know.
When did she agree to this?
Last week on the phone. Yeah.
I'm going to throw this out there ahead of time.
Okay.
Not that we don't have success stories. Not that we don't. But I would literally put that success story really high at the top. If not the number one, like the first time I saw this girl, I was like, oh my God, this girl is going to die.
Yeah, literally.
To where she's
I was nervous that she was going to die on the couch. I'm like, she's dying right now in front of us. And she was just high as a kite, This girl was, so I don't want to say
I don't want to
much.
give away anymore because having her on here, wow.
Yeah.
Wow.
That's awesome.
But she's still, she had never worked out, never lifted a weight. And as part of her treatment plan, we told her, we want you, because this girl weighed, 74 pounds when she came in?
I don't know the exact number, but she was severely underweight. Yeah.
And so we started her off small, got her with our nutritionist and started incorporating, high protein, good fats, good carbs. And the thing is she knew what she needed to do. She's a smart girl, but was so overtaken by drugs that obviously she's not meal prepping. And we got her on that, but she had never had the workout piece, and got her involved in working out here a little bit with Haley and kind of working out, and Haley would meet her at the gym, and now she's going there all the time. I think Destiny just posted a picture with them too at Busybody last week or something. So
she's actually got some muscle on her now too.
Yeah, absolutely. And she's up to probably 100, 110 pounds maybe.
Probably more than that.
Maybe more. I don't know.
She's a small girl, though.
She's only she's 5 foot or 4'9", so that's tiny. Not. But yeah,
but she looks healthy. Very, very healthy. Yeah, more than your average.
She had a what'd she have? A broken what's this bone? Pelvic bone.
Pelvic.
Yeah. Remember?
Pelvis.
Yeah.
Pelvis.
Oh. Yeah. There's. I want to keep talking about this, but if she's coming on, I don't want to give stuff away because people will then understand. Yeah, dude, when Tom thought she was going to die, I literally.
Yeah.
I was like, oh my God, should we be taking this girl? Are we the right place?
Well, we didn't take her right then, remember? She opted not to come.
Yeah,
and then about a week later, Destiny got her into detox, and then yada yada.
Had to go to a very medical level of care first for a while.
She was there probably a month, I would imagine.
I think so. It was 4 or 6 weeks.
So we told her she had to gain some weight before she could come to us, and she did. But anyways, anything else?
No, I enjoyed talking about all that. This whole journey has to be so holistic, and even amongst the when I go out and do the outreach stuff with like other facilities for referral purposes and whatnot, like a lot of people are like, oh, you're rock, you're all the meatheads. And I'm like, dude, it is not like that. Like I had to explain that to somebody today, like, oh, you're the gym bros. I'm like, dude, you don't understand. Like I get more women out there in their 60s doing this, and it please don't look at us like a bunch of meatheads.
I mean, you can look at me and tell I'm not. You know, you look like a meathead.
I don't think Ben looks like a meathead. I think Ben looks good.
But you have to like you're in this, you know. No, you don't look like Jay Cutler, but to somebody that doesn't work out, you look like a meathead. Like you have Pierre. He looks like a meathead to the average person.
She's used to meatheads, I guess.
I guess.
Like you got to, you know, it's you live with a meathead, you work with a meathead. They're meatheads.
Okay.
I'm not a meathead. I'm like a.
What am I? What do you consider me?
I would consider you well, a doctor first and foremost.
Before you insult me, yes.
No, I would consider you
a meathead.
No.
Okay.
But I would say you have a very high emphasis on fitness.
What is the female term for meathead?
I don't know.
Yeah, what is it?
There's gotta be.
If there was one, I would call you that.
Okay.
I
That's
would
fair.
because
That's
I think
fair.
you're, you know, I called you this morning and you're like, oh, I just finished working out. Again, though, like that's awesome. You should work out in the morning. And I don't think there's anything wrong with saying you're a meathead. You know, like say it with pride. I actually wish people would call me a meathead. But I just look like a fluff ball right now. I kind of with like a little Pillsbury Doughboy with some melted candle look.
You like the melted candle analogy.
I have a lot of muscle, but it's overshadowed.
It's hidden.
It's hidden.
You are strong.
I'm very strong.
My man can squat and deadlift.
My knees, though, my knees are getting rough. But that's a topic for another day. Don't take my meathead thing personal. I think that's a compliment.
I'll get therapy after this. It's all right.
All right. Are you good?
Yes, we're good.
All right. That is it for this episode of Real Recovery Talk. Thank you for tuning in. In the end, if you have any comments, questions, or concerns, you can always reach us info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message. That is it. We will see y'all later.